All right.
There we go.
Good.
Neil, we've
So
got you now. Brilliant.
can you hear me now, David? Is that all right?
We can. All good to go. It's over to you, Neil.
Okay, great. Yeah, so thanks for having me, and really enjoying the conference. And a big thanks to the strategy unit for putting this on, but also kind of being sort of one of the supporters of this work as well. So I'm kind of struck by what enormously on a shoestring budget, what the strategy unit's able to do, if you see what I mean. So I think do sort of present enormous value for money for the NHS. So yeah, I'm Neil Walton. I'm a professor at Durham University Business School. I'm a mathematician really by training, and I'm kind of a queuing theorist in terms of my research specialization. I'm kind of not completely new to health, but sort of like 3-4 years into working on health data. So I'll explain a little bit about that. And really what I'll focus on today is a system that we have for sort of tabulating the NHS waiting list. What I'll do first of all is, because I realize slides are boring and I'm probably boring, is that so if I go to the first slide here, what I'll do is I'll copy over a couple of links, and you can just play around in the background with the table. So I'll put that as a link in the chat. Hopefully everyone can see that. Also, there's the GitHub version on my own GitHub. If that sometimes GitHub works for people, sometimes it doesn't. And then also there's a copy of the slides for later if anybody wants them. Okay. Just to ask in terms of the chat, can people access the link that I've just sent over? Also, you can scan this with your phone as well if you want to play around on your phone or your iPad or whatever. Do people have access to that? Yeah. Okay. So yeah. So if I'm boring you with the slides, just have a play around with the table. Okay. Good, thanks. So what's this about? So how did this come about? So there's a little bit of background. So basically, this is the general picture of the NHS waiting list. In red here, we see the waiting list size. Basically, since about 2011, the waiting list has been increasing till December 2019, at which point it went under a big increase due to COVID, but it was already significantly off target by that point and would have continued to go off target. And what we're seeing now is this kind of push to bring the waiting list back in line. And then here you can see sort of the levels when the targets were last made at about 3.6 million, and at the lower end about 2.4 million with the waiting list size for making targets. And then here's some estimates that I'll go into a little bit of detail about what the national waiting list size has to be to make targets. Okay, so that's sort of a little bit of data on what's going on and what we're looking at. And obviously, at government level, it's one of the government sort of priorities or missions to get this down to target levels by the end of the next parliament, which is going to involve removing about 1 million people off the waiting list every year until 2020. Was it 2029? Is it when the next parliament ends? Okay. So basically, I was at Manchester University, and I worked with the local NHS trust, and we developed a series of metrics which were available to managers for understanding their waiting lists. And we made a kind of short report on this, and there's a link to the paper there. And I gave a talk to the North Midlands Analyst Network a couple of years ago. And there's a video of that there, which just explains basically all the kind of usual mechanics of how a queuing system works, not necessarily for NHS, but just queuing in general. But I try to phrase it in a way that's more accessible to NHS managers. Okay, so do check out that paper, or even better, maybe just watch the video. So I won't go into all the details of all of that now, but it explains all the kind of main things you should care about in terms of waiting lists. Okay, so at that point I kind of left Manchester and kind of wasn't sure what the next steps were this, so that's why I just kind of put it up on medRxiv and kind of left it, and it still kind of sits there. But the strategy unit were very kind to kind of link me up with their kind of R community. So the NHSR community helped develop this R package called the NHSR waiting list package. That's now available on CRAN. So if you just go on R and do install.packages NHSR waiting list, you can install that on your computer and start trying to analyze your NHS waiting list problems. it's still very much a kind of active project that we're still working on, but we've got sort of installation, some documentation, some worked examples, explanatory videos, and so forth. And so, so if you are kind of an analyst who's used to working with R, then this is for you. And we're kind of happy to work with people to try and improve the package and then help it solve your problems better. Okay, and so the point is to calculate all the statistics that you need, make plans, simulate things, calculate how much capacity you should be giving to your different services. Okay, right. So that's sort of good if you're an analyst who's used to working in R. A second spoke was some calculations that we've been doing with the strategy unit and others, sort of for Cabinet Office, where we were looking at what the national waiting list size should be in order to make targets. Here's a kind of quick calculation that I'll maybe mention about later, that calculates that the waiting list has to be about half the size. So this was done about a year ago. This calculation, and then a couple of weeks ago, we wrote a paper came out with using sort of slightly more advanced numerical modelling on the NHS waiting list and saying it should half in size. And depending on which side of the political spectrum you lie on, that got into the press a bit. So there's a Morningstar, LBC, Independent, Telegraph, or Spectator. So from left to right, depending on where your political persuasion is, you can click on one of the links there and see that article about that work. Okay. Another thing to say is that with Mohammed, who's one of the people who's been helping with the tabulating work, next year in June 10th and 11th, we'll have the first National Waiting List Conference that's going to be in the Wellcome Trust. And so aside from all this tabulating stuff, there's a conference site link there on the slides and also an abstract link. So if you've been working on waiting lists, we really want to hear from you. We want people to be involved and contribute to that because it's a big problem in the NHS right now, and it might require some sort of modal shift in the way the system works. And so we really want to encourage the conversation around that. Okay, so good. So that's all not really about tabulating the NHS waiting list. So let's talk about this national table. Again, I'll mention what the motivation is. So, all the things there are kind of hit at different levels, some policy levels, some for analysts. But I wanted something that just someone in a hospital trust could just use. I've noticed that, so one, obviously waiting lists are a big problem everywhere at the moment. Underlying data is actually published and nationally available, but it's not very easy to interrogate and access and use. So the point was just to basically have something where you can essentially slice the data by organization, specialty, treatment, function, and then essentially use it to understand your waiting list problems. So, even in terms of my own personal usage, I'd say I was taken off the waiting list about 2 weeks ago or 3 weeks ago myself. And I actually used the table just to tell you which is the local trusts in my area, which are going to get me seen quickly as possible. And I think I got seen in about 4 weeks, fortunately. I think I was a bit lucky in that, but I also was able to interrogate the data a little bit, which is publicly available, and understand where things are going. But the point is really for people within trusts to be able to use this. The aim was to build a single table, a single transparent national table that tabulates all the NHS waiting lists, that's faithful to the published data, easy to explore, reproducible, but more importantly, I think, is actually sort of quickly identifying where the bottlenecks and the pressures are within different trusts. Okay. So that's the aim. Again, here's the link. I can maybe briefly run through the table over here. So let's just get it open. I'll just explain what the table does. So essentially, here I've got every provider in the country, every treatment code. This could probably be done in Excel as well, but I've done it in HTML, so it's more easily available, and different treatment functions. And then I look at basically what the waiting list size for all of those are. I calculate what the waiting list size should be if it was going to make its 92% 18-week target. And then I calculate how far off that waiting list is off its target as a multiple. Okay. So these are the category which I count as the kind of size category. So is your waiting list too big, and if so, by how much? Then there's the shape category, which is basically asking, is your waiting list a bit? And what you typically find is waiting list should be a nice exponential distribution. That should be sort of fairly unavoidable. But when people start to introduce sort of special measures and other things, it tends to tilt that distribution in strange ways. And so essentially the percentiles of your waiting list are an indicator of how things are doing relative to that. And so we have this metric, which is called the percentile pressure, which essentially determines how much pressure is on that list according to its kind of shape. Okay, so that gives the shape things. And then the third area that we've organized things into is how much is that area improving by. So basically, how many people have you removed over the course of the last year? So this specific table is from May last year to May this year. What has been the improvement in your waiting list statistic? What is the relative change in the waiting list? What is the percentage change improvement? And more importantly, I think that the more interesting metric is the load, which is basically what percentage is your service rate, your arrival rate compared to your service rate. So you want your service rate to be bigger than your arrival rate, and so you want this load to be less than 1. So anything that's less than 1 is good. Anything that's bigger than 1 is bad. Okay, all right. So let's interrogate this a bit. Would anybody like to focus on a specific specialty? Just write in the chat. I'll give people 1 second, or we can do a whole provider if we wish. Orthopedics, okay. So I think that should be so these are orthopedics. So the code is C1. I'll get this code right. C110. Okay. And so, and would you like to look at the size or the distribution or the change in that area? So I'll let anybody go. Size. Peter says size. Okay, great. Okay. So if we rank it from biggest to smallest, the biggest orthopedic surgery, biggest orthopedic waiting list in the country is Mid-South Essex Foundation Trust. Okay. It has 18,000 people waiting in it. It has a queue size target if it's going to meet targets of 5,000. It is 3.5 times bigger than it should be in order to reach targets. Okay. Right. That doesn't necessarily mean it's the worst in the country in terms of how it is relative to its size. So if we rank this now according to relative to its size, then we find that actually Hillingdon Hospital NHS Foundation Trust is the most off target relative to its size. Okay. So notice here, I can essentially use this to rank every trust in the country according to how it's performing in terms of its size. Okay. I could also filter this down. So if we might want to focus on larger trusts. So if I focus on the largest trusts in the country and then rank that according to how far off target it is, then we find that, for example, Robert Jones and Agnes Hunt Orthopedic Trust is the one in the most strife in terms of being off target. Okay. I could also interrogate amongst large trusts which are the most improved. So, for example, Norfolk and Norwich University Trust is the most improved trust. It's moved its queue size down by sort of 10%. It's going down by each year. Okay, so it's very simple that we just have a series of filters here that you could probably have on an Excel table, but it's a way of essentially interrogating across different trusts how things are performing in terms of, say, in this example, orthopedics for large trusts, in terms of their size or in terms of how they're doing in terms of improvement. We could also just look at one trust. So we looked at this Norfolk one here, RM1. I can look at they only focus on orthopedics. Let me try another example, maybe this next one, Royal Surrey, so RA2. RA2, and I'll remove that's one. Let's choose a bigger trust. RYI. So I can look here across all of the services that this hospital offers, and then I can look at the ones that are doing the worst. So in this example for this Sussex hospital, T&O is their big bottleneck in terms of size, whereas other policies here, if we go down to other services or cardio, are actually doing relatively better. Okay, so I can essentially rank all the specialties within that trust and give an objective view on how its waiting lists are doing in terms of size. Other ones we see here, like for example, neurology service is quite far off in terms of size, but it's actually improving at the moment, whereas we see the T&O is not. So it gives a way to interrogate all the different lists across the country. It's also useful because some trusts are bigger than others, and so it gives a way that I can sort of, if we've had meetings with some large hospital trusts, and they'll say, oh, well, this is off target because we're a big trust, and that's so and then you can relativize it relative to other trusts of the same size and say, well, actually, no, even relative to other large trusts, this seems to be a problem area, whereas other areas, which, and so you can start to pick up some of these things. And you can also pick up lists which seem to be doing well because they're not too large, but then actually, in terms of, say, their distribution or their shape, actually a little bit off where they should be as well. And so that suggests that some sort of better performance management is needed to improve those lists. Okay, is that reasonably clear to everybody? I can go into more detail there. I'm conscious of time. So do stop me. But are there any other comments? Yeah. Okay. I've got a bunch of other slides. I won't spend too much time boring you with them. I think I'm kind of out of time in 3 minutes. I'd rather take questions. But the point is to essentially have something that's usable, accessible, easy to play around with. So, hence you can just click on the web link there that I sent over and just have a play around. I explained a little bit about some of the calculations that might be of use to you. In terms of this, so just to say the last two things is the abiding principle of this work, or everything we've been trying to do, is try to keep things simple and accessible and practical for people. The approach to the waiting list problem by the strategy unit and others is to be holistic, try as many avenues as we possibly can in the hope that something sticks with people. And obviously what sticks with different people depends on their skills, specialties, positions, and all the rest of it. I'm particularly grateful to the strategy unit for helping with this. So all of the table will be put on the strategy unit's website, so anyone can use it. Money is tight, but people tend to be generous with their time. So, many people have been very generous in the analyst community in helping develop some of these works. And there's a set of names there that have been very helpful, particularly, say, with the R package and otherwise. So big thanks to all of them. The final thing I'd say is do get in touch. My email's there. If there's anything you want to see added, changed, altered, if you want us to run this with your data and you think that would be useful for your trust. I haven't done things on priority codes because that's not publicly available, but we could equally do that. So there's lots of things we could do to help interrogate, improve, and identify bottlenecks, and then hence hopefully improve the situation for waiting lists and through some of these methods. Okay, thanks so much.
Thanks, Neil. We've just got time for one question. I did want to ask this one. One of the attendees has asked if there are any plans to expand this to include Welsh health boards.
Welsh? I mean, I'd love to. We have a version of the table of this, a version of the waiting list work was implemented in Scotland. So there has been a Scottish version of this. I'm not sure how much we got taken up, but there was an analyst too. So we're happy to work with whoever. If you send me the link to the Welsh data, I'm happy to have a go at it. I mean, I'm more than happy to. Okay. Again, like if people want to work with me on that, just email me. I'm happy to try and get things together.
And we've had another question just coming quickly about how you've accounted for patients being removed from waiting lists due to admin or gaming issues rather than actual treatment of the conditions.
I'm just working with the national data from the RTT thing, so I leave that to the national team to make sure their data is sufficiently clean. All I've tried to do is take what's there, add some statistics which are hopefully more meaningful in terms of identifying bottlenecks, and then remove those. So I haven't done all the data cleaning, I'm afraid, though in principle one would have to do that. Yeah, and when we've done things locally within trusts, that's something we've had to be very careful with, obviously. Yeah, people who've been on the waiting list for 1,000 years and things like this, or strange birth dates and things like admission dates and things like that. So there's all the usual data wrangling and cleaning that needs to happen if you're going to put this within your system. Yeah.
Thank you, Neil. Well, we're going to have to leave it there, but I'm sure lots of people are playing around with the table in the background. And thanks you so much for joining us today.
Play around the table. Send me an email if you're interested. Thanks so much.
Thanks, Neil.